Perfect. Recording is now in progress. Thanks, Chloe. So my name's Roisin. I am one of the co-directors for UK Youth4Nature. And we're really, really chuffed to be here alongside Breast Cancer UK and ChemTrust this evening, talking all about chemical pollution, which is a pretty hot topic at the moment. We just ask that everyone keeps their cameras off and you stay on mute until the end, where there'll be a portion for questions. If you don't want to ask your question out loud, that is absolutely fine. I'll be chairing that session later on. You can just put questions in the chat. Chat function will be there for you to use throughout the whole of the presentations. So that's absolutely fine. But if you would rather articulate yourself beautifully, then you'll also feel free to do that as well. So I think I'm just going to quickly, I've introduced myself, but I'd like to also introduce Dr. Shubhi Sharma, who is the Scientific Research Assistant at ChemTrust, and Dr. Hannah Moody, who is Head of Science at Breast Cancer UK. As I say, really chuffed to have you guys on the call delivering what will be, I'm sure, a masterclass in chemical pollution. So I think we will get started. So I'm going to ask Ellie, who is in the background from ChemTrust, to start sharing your screen, please. And I'll hand over to Dr. Shubhi Sharma.
Thank you. Thank you, Roisin. Thank you so much for inviting ChemTrust to speak at today's webinar on such a crucial yet often overlooked topic. So ChemTrust is a charity that works at international EU and UK level to protect people and wildlife from the long-term impact of harmful chemicals. We're experts in chemical policy, and we work to achieve our goals with policymakers, scientists, other charities, and civil society groups. You can find out more about our latest work and how to reduce your exposure to chemical pollution on our website, by following us on Twitter or finding us on Instagram. So while the climate and biodiversity crises typically occupy headlines, when it comes to the environment, a further crisis, chemical pollution is frequently left in the shadows. Scientists have estimated that we have overshot the planetary boundary for chemical and plastic pollution, increasing the risk of large-scale, irreversible environmental impacts. So planetary boundaries, put very simply, they are thresholds within which humanity can survive, develop, and thrive for generations to come. The Lancet, which is one of the most respected scientific journals, has estimated that all forms of pollution, including chemical pollution, are responsible for 1 in 6 deaths globally. So why do we have a chemical pollution problem? Now, since the 1930s, there has been a huge increase in the global production and use of chemicals in many kinds of consumer products. For decades, chemicals could be sold legally without any information about their safety. And although chemical regulations have improved, we still don't know enough about the chemical safety of most chemicals. On the EU market alone, there are 100,000 chemicals sold, but only 500 of these have been extensively studied to understand the risks that they pose to human health and the environment. Daily, through the air we breathe, the food we eat, and the water we drink, and the products we consume, we are exposed to a complex chemical cocktail, which current regulations fail to properly understand or protect us from. The whole planet is awash with chemicals that we don't have all the data on. It is like the Earth is a giant petri dish in some irreversible experiment. So now I'm going to zoom into one example of chemical pollution from just one group of chemicals to illustrate some of the harm that they are doing to people and the environment. I will also talk about the failure of current policies in the UK to regulate these chemicals, and crucially, what we can do to solve this problem in the UK. So you might have heard of the term forever chemicals in the media. So forever chemicals refers to a group of chemicals which are known as PFAS, or per and polyfluoroalkyl substances. PFAS are a very large group of around 10,000 chemicals, and since the 1950s, they have been used in an increasingly wide range of industrial and consumer applications such as textiles, electronics, your cosmetics, food packaging. And this is because of their ability to repel both grease and water, which are very handy properties. But it is these very properties that also make PFAS incredibly persistent, which means that once they are in the environment, they take many, many years to break down and will basically remain there for generations to come. And this is why they're referred to as forever chemicals. There is clear and unequivocal evidence that PFAS are contaminating every corner of the globe, from the ice sheets in the Arctic to raindrops in the US and drinking water all around the world. People across the world are also contaminated by PFAS. PFAS have been found in the blood, in the breast milk of most people that have been tested for their presence. And worryingly, two of the most studied chemicals in the group, PFOA and PFOS, are toxic to humans and wildlife, and they have been shown to impact the immune system, promote the development of certain cancers, and interfere with the development of the fetus. The more we learn about these substances, the more concerned we are about their impact on our health and the health of wildlife. Breast Cancer UK will be explaining more about the impact of PFAS on human health later on in this webinar. And for now, I will explain you a little bit more about the environmental impacts of PFAS in the UK. So last year, a PFAS mapping project found about 17,000 polluted sites across Europe and the UK. And the ubiquity of PFAS pollution, which was detected in our groundwater and rivers in this project, was consistent with the UK government's 2019 assessment on water quality standards that showed that not one single lake, river, or estuary in the UK meets legal chemical water standards. So this is why the work of UK Youth for Nature and others to raise awareness of the appalling state of our waters is so crucial. So it is perhaps unsurprising, based on this level of contamination, that PFAS are also being found in the UK wildlife. For example, a study that was conducted in England and Wales in 2022 detected the presence of PFAS in the livers of all of the 50 otters that were tested. Scientists have been finding PFAS in gannet eggs from a North Sea and an Irish Sea colony for the last 35 years. And PFOS, a substance which has been shown to promote the development of certain cancers, was detected in all harbor porpoises that a government body tested between 2012 and 2014. And I could keep going on and keep giving you more examples. So this next slide shows some of the other animals that have been tested and have been found to be contaminated with PFAS in the UK. Unfortunately, less data is available on the toxicity of PFAS in wildlife than it is in humans. However, available studies show that chronic exposure to PFAS could affect the immune system of otters and the immune system and kidney and liver functions of bottlenose dolphins. Many species around the globe are already suffering from the effects of climate change and habitat loss. Chemical pollution puts species at even greater risk of harm. So how are PFAS currently regulated in the UK? So at the moment, just 4 groups of PFAS are banned in the UK, 3 of them via an international treaty that the UK is part of, which is known as Stockholm Convention, and the other one that was restricted before the UK left the European Union. So except for these substances, all of the other PFAS are currently allowed to be produced and used in consumer products or industrial applications. So in the February of 2023, the UK published something which was known as a risk management option analysis on PFAS, which basically assessed the current way that these substances are regulated. It also looked at risks to the environment and public health, and it put forward some non-binding recommendations for the government to follow. Very unfortunately, however, the ambition in this plan falls far short of what is needed. The approach set out in this document was to restrict a very narrow range of PFAS, just a few hundred, as opposed to the thousands that exist, and only for certain uses. So a restriction on PFAS in firefighting foams. So PFAS are used in firefighting foams because they help in cooling and suppressing fire. So a restriction on PFAS in firefighting foams was one of the few which was mentioned in the RMOA. And a year on from the publication of this document, we have yet to see any action on even this one measure. Now, considering the scale of the planetary crisis, it literally rains PFAS. We must turn off the tap on PFAS to stop adding to the levels of pollution that are building up in the environment and that we and future generations will have to live with. Society has to stop its reliance on PFAS. It is hugely concerning to think that on the other side of the English Channel, the severity of the PFAS crisis is being taken more seriously by European authorities than our own government. Our European neighbors are already benefiting from better regulation on PFAS since we left the European Union. Most importantly, in 2023, what might be the most ambitious proposal ever seen on harmful chemicals was published, with 5 countries in Europe putting forward a restriction on all 10,000 PFAS substances. So if this proposal is adopted in the European Union, all PFAS would effectively be banned in the EU from all uses with a very small number of exemptions. The ambition is to achieve a PFAS-free economy where the manufacturing, use, and emission of PFAS is stopped. In the UK, NGOs have been calling on the UK government to match this ambition, and at the end of last year, launched an action plan on how a phase out of all uses of PFAS could be achieved in the next decade. So we urge you at the end of this webinar to take 5 minutes to write to your MP or call for the implementation of the action plan, which will lead us to a PFAS-free economy. The email also calls on the government to align with other EU bans and controls on harmful chemicals. The UK is falling behind these important controls, which means we are less protected from many other harmful chemicals, not just PFAS, as compared to our European neighbors. We also urge you to spread this call to action far and wide. Tell your friends, speak to your parents, share the message on social media. And if you can get 5 people to write to their MP, this will make a world of difference. Today's youth will pass on this mounting burden of pollution to future generations unless the UK government changes its path. Young people acting for climate have already achieved so much, and young people can also bring about urgent action on this crucial issue. So let's take the message to our government that we do not want our bodies, wildlife, and our environment to be polluted, and they must turn off the tap on PFAS. Thank you very much for listening, and I will hand back to Roisin now.
Shubi, that was absolutely fantastic. And I'm sure many people will also feel quite horrifying because when we think about, particularly around planetary boundaries, we often focus so heavily on climate and carbon and nature, but we don't necessarily think about chemical pollution as a planetary boundary. So thank you so much for that fantastic presentation with as we've highlighted there, a real action point, which we'll return to at the end of this, and hopefully we'll be able to get at least 5 people each to be able to email our MPs. But for now, I'd like to pass over to Dr. Hannah Moody, who's Head of Science at Breast Cancer UK, who's going to talk us through the health impacts of some of these forever chemicals.
Brilliant. Thank you very much, Roisin, and thank you to everybody for joining today. I'll just wait while the slides load for a sec.
Classic, Hannah. We had a successful tech run prior to this.
It's always the way. It's always the way. Lovely. There we go. Thank you very much, Ellie, in the background there. Lovely. So yes, lovely to be here. Thank you very much for inviting us to talk today. So as Roshi mentioned, I'm Hannah. I'm the head of science at Breast Cancer UK. So today I'm following on for that really fantastic talk from ChemTrust and filling in essentially a bit more further detail about what chemicals can do in terms of our breast cancer risk and health more generally. So if we kick off with a little bit of a quiz. So hopefully you guys will be able to see this. So it should pop up as a little poll on your screen, and we'll just give you a quick minute to pop your answers onto there, and then we'll have a little go through. Absolutely no pressure, and unfortunately there is no chocolate bar at the end that I can send out to everybody for the winners. So getting the answers right is fantastic prize enough, unfortunately.
I'm not seeing the poll. Is anyone else seeing the poll?
I'm getting some responses in, so I'm hoping.
It's just me, Chloe. Ignore me.
All different settings on.
Right, I think we'll probably end it there, Chloe, if that's all right, and we'll have a quick look at the answers. Lovely. So the first one, endocrine disrupting chemicals are chemicals that can alter how a hormone works. That is true. PFAS stands for, unfortunately, it doesn't stand for Pretty Funny Animal Stories. It is the first one. The third one there, PFAS, BPA, and triclosan are all examples of, and again, unfortunately, not punk rock bands of the 2000s, but endocrine disrupting chemicals. And then the fourth one there, PFAS are also known as forever chemicals. So ChemTrust just beautifully elaborated on that. And then the fifth question, where have scientists found PFAS? And unfortunately, the answer is all of the above. So in all of those tissues that we've talked about there. So thank you very much for everybody going through that. So with that, we'll kick off for the breast cancer side of things. So just next slide, please, Ellie. Love you. So I'm going to redirect us a little bit from the quiz and initially talk about breast cancer itself. So breast cancer rates in women have actually doubled in the past 50 years, and around 56,000 women and 400 men each year are diagnosed within the UK with breast cancer. Next slide, please, Ellie. In 1996, it was estimated that essentially a woman's lifetime risk of developing breast cancer was 1 in 12. Today, if you were born after 1960, then your lifetime risk is actually 1 in 7. So that risk has actually shrunk and it's more common now. Next, thank you. So this kind of poses the question, okay, well, that's all fair and good, but what actually causes breast cancer in the first place? So fundamentally, cancer arises essentially because of uncontrolled cell growth in our bodies. Next slide, please, Ellie. Thank you. And really importantly, for the context of what we're going to talk about for breast cancer, estrogen. So estrogen plays an important role in breast cancers, in lots of different breast cancers, because essentially it can actually affect how often our cells divide. And really importantly for us in terms of breast cancer, this bottom bit here, that lifetime exposure of high concentrations of sex hormones, particularly to estrogen, increases breast cancer risk. Next slide, please. So let's talk about risk then. Next slide again, please. So there are a number of risk factors that we can't change, and they're also known as our intrinsic risk factors. And the two most significant of those are being born female and getting older. So in the UK, about 83% of breast cancers occur in women who are over 50. And essentially, the older a person is, the greater the risk of breast cancer, and much like other cancers as well. Also, being a woman means a greater lifetime exposure to estrogen, and women tend to physically have more breast tissue that could possibly become cancerous as well. There's several other factors as well, such as things that are listed here, for example, genetics, family history, previous diagnosis, and heavy birth weight as well. Next slide, please. But at Breast Cancer UK, we actually estimate that at least 30% of breast cancers are preventable. So what do we mean by this? Next slide, please. So if we're talking about prevention, then we're talking about risk factors, essentially, that we can change, something that we have control over. And we also know these as our modifiable risk factors. So these include things like diet, what we eat, our lifestyle, how sedentary we are, how much alcohol we consume, if we consume it at all, how much physical activity we do, our weight, if we can have children, having them before the age of 30, and breastfeeding them or not. And also this one at the bottom here, potentially exposure to endocrine disrupting chemicals, which we'll come back onto in just a moment. Next slide, please. So our endocrine system is also known as our hormone system. They're exactly the same thing. Essentially, it's vital for regulating lots of our biological functions, such as our growth and development, and we wouldn't be doing very well without them. Essentially, there's around 50 different hormones within our bodies that are circulating, and they all do very different jobs. Endocrine disrupting chemicals themselves, or EDCs as they're often known, are essentially any chemical or mixture of chemicals that can interfere with any aspect of a hormone's normal action. So these are what we call exogenous chemicals. So these are chemicals that didn't originate in our own bodies. They've come from the outside and are having an effect on us. So if you look at the diagram here, there are lots of hormones in our body which EDCs can potentially interfere with. Several of these hormones are actually linked to breast cancer risk, such as the sex hormones estrogen and progesterone, and potentially testosterone. So that estrogen link is starting to become more viable here. So really importantly to note that EDCs often act at really low concentrations. So that's similar to how hormones act. So if we think about scale, we often measure hormones at a nanogram or a picogram level, and that's a billionth or a trillionth of a gram. So these are tiny, tiny, tiny quantities that have a very big effect. So really this is illustrating that even though we have a very tiny amount of these things, potentially they have a very big effect on us in our bodies. So EDCs can damage our health in a number of different ways, depending on essentially which hormone is disrupted. For example, as ChemTrust touched on, they can increase the risk of things like diabetes, cardiovascular disease, and infertility as well, and also some hormone-related cancers. Next slide, please. But EDCs themselves are actually first identified in the 70s in the US by scientists who had observed some reproductive changes in wildlife, and that was in polluted rivers and lakes. And by the 80s, scientists had started to make more connections around the world, and they'd seen essentially more changes in wildlife that was particularly near sewage ways. For example, they'd found male fish that also had eggs and testes, so both female and male characteristics. And what they later worked out essentially is that this was a result of chemicals found in the sewage that were made up of synthetic estrogens. So we zoom forward a little bit more, and then in 1991, the term EDC was coined, and it really describes a very large and varied group of chemicals, which are mostly synthetic, so they're not something that's natural. EDCs are now known to be widespread in the environment, and they're present in water, soil, air, and wildlife. They're found in polar bears in the Arctic, penguins in the Antarctic. They're usually synthetic, but they can, really importantly, they often take a long time to break down as well. Next slide, please. So many chemicals can actually be found in our everyday products, are actually potential EDCs. So some of these can mimic the actions of natural estrogens, and in doing so, they can potentially increase our risk of breast cancer. So these include things like parabens. They're often used as things like preservatives in cosmetics. Glyphosate, so that's a certain pesticide that's kind of a weed killer. Bisphenols that are used in different plastic manufacturing, one of which is BPA. So you might have seen on plastic bottles and baby items and things saying BPA free. That's what we're talking about there. The antimicrobial agent triclosan, that's used, for example, in some older brands of toothpaste and liquid soaps. Bromiated flame retardants, used for furniture and furnishings to make things flame resistant. Phthalates that are used in perfume. They're a chemical that tends to hold the smell of things, so they're used in that sort of context. And also PFAS, which Chemtrust has just already elaborated on, which can be used in food contact materials, things like takeaway packaging, that kind of grease-proof lining of things. Next slide, please. And sadly, as we've already kind of started to cover, EDCs are also found in our bodies, in our tissue and our bodily fluids. So some EDCs can bioaccumulate, which means that they can stay in our bodies for a long time. But we also have to consider other EDCs. The problem is also chronic exposure to some of these chemicals as well. So it's kind of with this in mind, it's important to consider also when in our life we're potentially exposed to EDCs as well, because that can affect risk. Next slide, please. So these little windows that are on here with the different images on, we refer to these times as the critical periods of susceptibility. So it's a bit of a mouthful, but essentially we're talking about during these periods, something like in the womb here and in puberty, the breast itself is undergoing a lot of development and a lot of alterations. And researchers suggested that exposure to harmful chemicals such as EDCs, particularly during these critical periods, can adversely affect essentially normal development. So in case of exposure in the womb, for example, these effects can be programmed so during that early development, but not manifest until adulthood. Next, please. And we actually have a real world example of this. So you may or may not have heard of DES. So DES was a drug that was prescribed in the 40s, between the 40s and the 70s to women with high risk pregnancies. And it was used as an anti-miscarriage drug. It was the first chemical that was shown to cross the placenta and cause adverse effects essentially later on in life. So in 1971, it was actually linked, this exposure to DES with a rare vaginal cancer. And later on, it's now been established that there's a higher incidence of hormone-related cancers in the offspring of women, essentially, who were prescribed this DES during their pregnancy. Really importantly as well is that DES has also shown multi- and transgenerational characteristics, meaning that even though that person who was pregnant at that point had that drug, it's affected their children and potentially their grandchildren as well. Another example of a group of chemicals that can act as EDCs, as we noted previously, are PFAS. Next slide, please. So, as discussed, PFAS is a really large group of chemicals, and studies in humans have observed some links between higher levels of some PFAS and things like kidney and testicular cancer, as well as other cancers such as thyroid, prostate, ovarian, and bladder. Population studies have also suggested that there's a possible link between PFAS and disruption of periods and the quality of quantity of sperm as well. Exposure to PFAS in pregnancy in particular has been associated with things like pregnancy-induced high blood pressure, as well as those possible disruption of developmental processes in the breast tissue that we've just spoken about just before. Members of the PFAS group of chemicals itself have also been linked with things like thyroid disease, elevated cholesterol, inflammatory bowel disease, and immunotoxicity as well. Next slide, please. So some PFAS are known, essentially all suspected EDCs, and PFAS we think can act by increasing estrogen levels or by mimicking its action. And we know that from that previous point that high levels of estrogen are known to increase breast cancer risk. So an analysis that was recently completed that's looked at all of the evidence in human studies on PFAS has found that exposure to two particulars, so PFOA and PFH excess, may increase breast cancer risk. Some others were shown not to increase risk. However, overall, the evidence suggests that exposure to certain PFAS could increase risk. But as ChemTrust has alluded to, again, it's really important to note that the vast majority of PFAS is a huge group. Most of them have never been tested, so the actual effects on human health are pretty much unknown. Next slide, please. So as you've heard, throughout our lifetime, essentially, we're exposed to potentially these chemicals from all around us. However, current government safety assessments tend to really only look at the safety of each chemical individually, rather than the combined effects of these things. And that's really a problem, because in reality, we're not exposed to one single thing at a time. We're exposed to combinations of chemicals. And that's sometimes called the cocktail effect. So you might see that on the news and things like that. And that can mean that potentially we have harmful effects even if single substances themselves are at normal, considered safe levels. It's actually the combination of these low levels together that can be more problematic. So in model studies, they've conducted some tests on PFAS in mixtures, and they've seen some additive effects in terms of toxicity with that. So suggesting that this kind of mixture is really a problem. Next slide, please. So this kind of poses the question, okay, well, if EDCs are everywhere, what can a person really do to actually reduce their risk? Next slide, please. Well, there are actually some simple top tips that we can suggest to try and help with this, including things like going fragrance-free, dusting and vacuuming often, using things like stainless steel pans instead of non-stick cookware, avoiding waterproof or stain-resistant clothes, avoiding takeaway boxes, single-use cups, things like that. You know, use reusable containers if you can, and things like looking for PFAS-free dental floss. And actually, when you're out and about and things like that, there are a few different options of things like apps that you can use. So one of those, which is independent of BC UK, is UKY. And actually, UKY is really useful because you can scan the product, and it gives you kind of a color-coded rating that can help inform you essentially of the health impacts potentially of that product, and it can give you suggestions of other things as well. So it's quite useful. Next, please. And then we at Breast Cancer UK also provide lots of resources on how to reduce your risk more generally. Things like our EDC in the Home Guide, our Chemical Eye Guide, they're all available for you to scan here or through our website as well. Next, please. And then another way in which you can explore how to reduce your risk is by taking our prevention quiz, which will give you essentially a few quick questions, and it will give you an individual risk profile based on your responses to the questions that can essentially help you identify areas that you might be able to make some changes to help reduce your risk of breast cancer. Again, you can scan there. So next, please. So if you'd like to support further, you could donate and do things like fundraising events. You could take the quiz and ask your friends and family to complete it. And we also have a pledge, so you can sign our pledge to support our policy work to restrict harmful chemicals as well. Next, please. So that's it from me. So thank you very much for listening, and I will hand back over to Roisin. Thank you.
Thanks so much, Hannah. That was absolutely fascinating, and I think a really important insight into why we should be in the environmental sector, make sure that we're working with other sectors as well to understand not just the impact on wildlife and ecosystems, but also on our health, because we're all hugely impacted by these things. So this takes me to our presentation. So I'm representing UK Youth for Nature, and I want to take us to a place where we can understand what we can do next. And we've had two kind of fantastic summaries of how you can get involved, but I want to talk to you a little bit about what we specialise in and how we take some of these issues and transform them into actions. So if you haven't heard of UK Youth for Nature, we're the UK's leading youth network that calling on the government to take action on nature loss. And we're made up of 16 to 35-year-olds, and our team is composed of a very large organising team now, which is absolutely fantastic, of really enthusiastic and wonderful volunteers who lead a lot of this work. And we've kind of specialise in creative campaigns, as I mentioned. So some examples of that are our Line in the Sand, which was a big sand drawing piece to kind of highlight the loss of species and the fact that time is running out. We also have lots of community events, as well as our campaigning as well, trying to make sure that young people feel supported both with their career and their career trajectory, as well as just maybe being a nature nerd like the rest of us. So next slide, please, Ellie. So I'm going to talk predominantly today about the campaign, one of our campaigns called Not So Freshwater. We have 3 campaigns this year. One is also really relevant to this conversation. It's going to be launched in the next month, called Your Wild Streets, and really focuses on going spray-free in our local communities. So that's a much more sort of hands-on grassroots piece. But our Not So Freshwater campaign is really tackling the role of agricultural pollutants and chemicals. And we knew that we wanted to tackle this, as we've kind of covered lots of different sources of chemicals today in the previous presentations. But there's not a huge amount of light shone on the impact of agricultural pollutants and chemicals on health, as well as in our freshwater ecosystems. And this campaign is designed to do exactly that. So last year we went down to London, a big group of us, and we hosted our chemical cocktail bar with Wildlife and Countryside Link. And it was really based along the incredible and quite frightening data that the Rivers Trust were able to analyse based on environmental agency data, all about the chemical cocktails that are in our rivers. So we know that toxic chemical cocktails were found in over... That's the dog behind me, apologies, in over 1,600 rivers and groundwater sites, according to this analysis. And so we wanted to take that and turn it into something that was really hard-hitting for politicians. And so we had an invite list that was comprised of MPs, as well as lords and baronesses, as well as civil society, to come and really get a sense of what the issue was and how young people felt about it. So we did lots of different things as part of this chemical cocktail bar. We had chemical cocktails. So next slide, please, Ellie. So you can see here on the left and the right, we produced these recipe cards. So on one side of it, there were a set of recipes that were a bit of a twist on the classic cocktail. So we had the Mersito, the Tay Margarita, the Severn Sour, the Gin and Tonic, and the Thames Keeler Sunrise. So we took 5 key rivers and invited MPs whose constituencies those rivers flowed through. And then using the Rivers Trust and Wildlife and Countryside Link data about the rivers, we found the types of pesticides and the types of PFAS that were in those rivers, and came up with a sort of quite dark twist on what that actual river cocktail looked like. And then on the back, we had the solutions. So these are the things that kind of policy asks, the key things that we wanted parliamentarians to take away. We obviously had the physical cocktails as well, and we had speeches from all sides of the parliamentary aisle, so to speak. And then we had young people talking to and communicating with these MPs and lords, as well as civil society, to really kind of push forward the fact that we care about freshwater pollution, and that young voices are really powerful in this particular space. But not only that we are shining a light on the areas that need to change, but shining a light on the solutions and how we achieve those changes. Next slide, please. So in 2024, we've got lots of more exciting plans on the way. So first and foremost, we are all about sharing youth voices to showcase that the impact of chemicals on our health and our wildlife and our future is a real priority for us. And we're also continuing to use art and creativity to bring communities together. So we want to highlight the seriousness of water pollution in all 4 countries, really, but using art and creativity. So keep an eye out in May for our next stunt that's coming that might just involve species lanterns, which you'll see more about as the weeks go on. And then we're also going to be hosting a Senedd event in Cardiff in July, which will bring together politicians, young people, and critically farmers who are doing really good work using nature-based solutions, and also reducing the numbers of and the amounts and the toxicity of chemicals on their land. And we want to kind of present this as young people and farmers coming together with the solutions to showcase to current politicians, as well as whoever succeeds in the next election, what we really want for our future and how we're going to go about and achieve that. Next slide, please. So I wanted to leave you with a few things. Firstly, that there is a real opportunity here to make change, not just with your vote, which we'll be exploring a little bit in our Vote for Nature campaign that will be launched relatively soon, but also that there are real tangible things that you can do and that you don't have to feel inert and stuck, unlike this problem. And it is a vast problem, but we don't want people to leave feeling as though they can't do anything with that problem. So we've got a few solutions for you. So as previously mentioned, we've got an email template that is available at the link, I think is already in the chat, but the link is also here. It's ready for you to go. All you need to do is put your name and your constituency in there, and then email your MP. We'd also love to hear the response that you get back from your MPs or your constituency offices. So please do feel free to email us and tell you what response you get back. If you're between 16 and 35 years old, then we'd love for you to join UK Youth for Nature. We've got an organising team of over 80 at this point and a wider network of about 200 people. So we'd love to have you on board to really sign up to that Not So Freshwater campaign. And then also there is an election coming up. So why not ask your candidates, because we are going to get candidates on the doorstep, ask them what they're going to do and how they're going to act to reduce chemical pollution. And fortunately, with that email template for MPs, there's a lot of really great content in there that we can transform into questions. But if you're feeling a little bit at sea, so to speak, and you're not quite sure what questions to be asking, please reach out to us via any of the mediums, via Twitter or Instagram DM or email, and just ask the question and we'll help you put together some thoughts. But yes, I think that's probably enough from me. So final slide. This now is going to be an opportunity for questions from the floor. And I think we've got some questions in the chat. So I'm going to open the chat up now. So please do get your questions in. So a question from Elise. The map of forever pollution was really interesting. Do you know why there is so much less chemical pollution in Scotland and Northern Europe / Scandinavia compared to other areas? That might be one for Shubi.
I don't think it has anything to do with the fact that there is not PFAS pollution in Scotland, but it is because of a lack of studies in Scotland. So we should definitely not assume that there is no PFAS pollution in Scotland, but definitely that there are studies lacking. And I wonder if my colleague Chloe wants to add to that as well.
I think you answered that perfectly. Thanks, Shubi.
I guess on that point, is there a real problem with monitoring and data collection? And is that something that we should be thinking about as youth campaigners that we can bring into the campaigns and kind of push for greater monitoring? Is that something that would be useful? Whoever wants to come in and answer that one. I think other Chloe from ChemTrust is always thinking.
Oh no, actually there was a question in the chat I could actually answer. But yeah, I mean we need to vastly improve our monitoring of of rivers and other sites. There are quite a few, we've seen that contamination of PFAS is everywhere now, but there are some areas which are particular pollution hotspots, and around kind of airports and manufacturing plants and so on, that will now need, very expensive remediation work on them, because it's seeping into the water and so on. I just noticed somebody had put in the chat about a question about what legislation should we be focusing on to make a difference to chemical pollution. So it's called, the main regulation for chemicals in the UK is called UK REACH, and it was developed from the EU version, and we are very worried about it because it was on leaving the EU system achieves these incredible economies of scale, and to put a chemical on the EU market, you have to provide data on it, and they have hundreds of people literally doing kind of risk assessments on chemicals, and then where necessary they ban those which are being used dangerously and stuff, and it's far from perfect, and it needs to be massively improved. But the UK system is a much weaker, much more poorly resourced system, that has more of a kind of interest in a bit more of a light touch regulation approach, and we're seeing it dangerously move behind the EU now. The EU have kind of, since we've left the EU system, eight groups of chemicals have been banned there, and not in the UK, on everything from sort of microplastics are intentionally added to products which are a big source of microplastic pollution, through to formaldehyde, which is used in furniture, or PAHs, which are carcinogenic and used in football pitches and children's playgrounds and so on. So our big ask is that we need to keep step with the EU. So we need to ensure that we do not fall behind and that we meet or exceed EU standards. And in particular, the EU is proposing, as Shubi said, a big group restriction on PFAS as a class, which is absolutely necessary, so that they can be completely phased out from our economy, and we should match that too.
That's a fantastic answer to that question, Chloe. Thank you. That's really, really helpful. There's a few more questions popping up in the chat here. So one from Kate saying, how can we recognise PFAS in everyday products? Is it possible? Hannah, is that one might be for you, that was possibly covered with the UKY app? Is that something that is covered in there, or is there another way of identifying PFAS in everyday products?
Yeah, to be honest with you, I think that some potentially are covered in UKY, but yeah, don't potentially quote me on that one. But I think the main thing is just to get an idea of where these things are utilised, to be honest with you. So things like food packaging to make them resistant to kind of water or oil and fats, things like that. Waterproof clothing, things like raincoats that are coated, that are super waterproof, those kind of things. Stain resistant furniture, things even like waterproof mascara, dental floss even. It's good to have a look out for any of those things. That just have a look on ingredients lists is the best probable tip. When you're out and about, have a look at what things are coated in, and non-stick cookware, things like that. Try to avoid that. I think Chemtrust have mentioned things like firefighting foams, but they've started to think about regulating and things. But in our everyday lives, there's lots of things that we can come into contact with, but there are some alternatives to them. So just check out ingredient lists where you can.
And are those kind of questions, or I guess not themes, but so categories of different things to think about, like for instance waterproofing, are those something that are covered or suggested in your resources that you were mentioning earlier on, things to think about?
Yes, there's some things. We've got some information on the website about those, and we've actually got some PFAS things that'll be coming online soon, and on the BC UK website. So yeah, we'll have resources very soon on those.
That's fantastic. Thank you very much. So one from Frankie, I've seen a cleanup effort using hemp, growing hemp on PFAS contaminated soils. what do you think will be some of the most important ways of cleaning up PFAS? And is there, I guess, much research on the cleaning up of PFAS? It's probably one for ChemTrust.
Well, there is evidence to suggest that certain techniques such as reverse osmosis, for example, can be useful in removing PFAS from drinking water, for example. There is also some evidence which shows that plants such as ferns, for instance, can help remediate the PFAS pollution. But then at the end of the day, the problem is that we should not be producing PFAS to begin with. So remediation is possible, yes, and we should be focusing on cleaning up the PFAS pollution. But it's really expensive. We don't have a cheap technology, and usually the burden lies on the taxpayer. So really, the main solution is ensuring that we stop producing PFAS. And like I was saying in my presentation, to turn off the tap of PFAS, pollution.
I like that, turn off the tap of PFAS. That's great. There's a lot of other things I think we'd like to turn up the tap off as well. So another one from Emily. Do you notice different levels of interest or support from different political parties around PFAS issues? Chloe, that might be one for you from ChemTrust. Sorry to throw you in there.
Oh, that's fine. There is, yeah, I mean, actually, just to alert people to the fact that the government's planning quite a sort of major sort of shift to how chemicals are regulated quite soon. There's going to be a big public consultation on new proposals for a sort of slightly different model for the UK that in our view will be even kind of weaker and has some sort of deregulatory elements. So, you know, any pressure in terms of, you know, the email to MPs and so on would be really helpful. And to ask, you know, if you do have any of the parliamentary candidates come over to your house, or if you're attending any hustings, you know, to put that kind of pressure on them would be really good. Labour have talked about wanting to keep to align with the EU, but we need to sort of hold their feet to the fire on that, and to, you know, make sure, because I think there's going to be quite a lot of pressure from the chemical industry not to do that. So, you know, whatever can be done in terms of sort of raising that, and you know, good, you know, hopefully there will be things on chemical pollution in some of the party manifestos as well, but we'll have to have a look out for that. But please do raise with parliamentarians and help them see that it's an issue that people care about.
Thanks, Chloe. And that is something that we will be looking to compare. So bringing from all of the different manifestos as part of our Vote for Nature campaign is just laying out what people have said, and hopefully we'll be able to work with ChemTrust on doing that. So look out for that on our social media. And another one from Elise saying, how much of a concern for health is chemical pollution from medications, health and nature, sorry, and are there any ways to address this? So that one is around, predominantly medications for health and nature. Hannah or Shubi, do you want to come in on that one?
I think it potentially is one more for Shubi, I think.
I mean, there are some, I can speak from the perspective of PFAS. We know that there are some PFAS which are present in some life-saving technologies. For instance, I think in an asthma inhaler, for instance, and even your pacemaker, for instance. And it's a very tricky question. I wouldn't know how to answer, because, you know, these are life-saving technologies, and some of these PFASs are available, are present in these technologies. So it's a slippery slope, I would say. But yeah, I think overall my answer would be maybe PFASs are required in some absolutely essential, technologies, but then they're not necessary in, other uses in which they are deliberately added. So a broader regulation and a strict regulation on PFASs, I think, is the best way for ensuring that we as a society remain healthy and we don't get exposed to large doses of PFAS.
That is a level of nuance that we like here at UK4Nature. So that's fab, Shubi. Thank you. So I think we've got time for one more question, and that is from Emily. How to avoid, I guess, not just PFAS, but also probably EDCs as well. Is there a way to avoid it while drinking tap water? Is there something around bottled water that is maybe relevant here? Or is that something that is not necessarily relevant to drinking tap water?
Is that one for me as well?
I think it's probably the elements of both, really. Maybe from a PFAS perspective, Shubi, and then from a EDC's perspective, Hannah.
I can have a go. So like I said, their reverse osmosis is one way of removing, well, not 100% removing PFAS from drinking water. But yes, it is something that has been used by water companies to sort of to a certain extent remove PFAS. But I wouldn't say that we don't know what's in our water to begin with. So it's really hard to say because there is so much uncertainty, and you might not like the answers that I'm giving, but there is a lot of uncertainty around, the kind of chemicals that are present in our drinking water. So if we don't know what is present in the drinking water, how do we, begin to avoid that? So yeah, I would say there are some technologies which exist, but then I would again go back to what I've been saying over and over again, to the only way to protect ourselves from PFAS is to really regulate them as a group and to stop their production because they are so persistent and they tend to accumulate in our bodies, they tend to travel in water. So it's really, really, really hard to remove them once they are in the environment. So the only way to protect ourselves from these chemicals is to stop their production.
A final word, Hannah, before I bring this to a close. If you have any thoughts on that last question.
Yeah, it's as Shubi's very elegantly put, it's very difficult because we don't know the extent of all of this, so it's very difficult to say. But in terms of replacing that with, for example, bottled water, which is often in a plastic container, it's not really the alternative that we probably would be suggesting. So yeah, it's difficult whilst we're still in a little bit of the unknown, but there are some technologies out there that Shubi's alluded to there that potentially could help.
Real. That is fantastic. We're 2 minutes over, so that's bad handling from me, everyone. I can only apologise, but I'd just like to just a huge thanks to both Hannah and Shubi and Chloe and Ellie from ChemTrust as well, who have been in the background, and Chloe, who I sort of dragged into the Q&A session there. Thank you so much. That was a really fantastic session. I know I've got many notes of which we will be incorporating into our Not So Freshwater and our Your Wild Streets campaign. Please do take that email and run with it and see if you can get 5 other people or 4 other people, including yourself, to send those emails to your MP, because as we have articulated here, the more we do, the better the outcome. So thank you so much, and I hope you all have a lovely rest of your evening. We're off to a campaigns meeting now, so I'd better head out, but thank you very much for coming, everyone. Thanks. Bye.